Thank you for your interest in NCCARE360. In this short video, Connecting the Dots with NCCARE360, North Carolina's statewide coordinated network addressing whole person health, we will provide a high-level overview of who we are and discuss the makeup of our program, including our partnerships and how we collaborate to run NCCARE360. We'll examine what it means to be a network partner so you have a better understanding of roles and expectations of joining the network should you choose to do so. And we will provide next step instructions for those who would like to continue working with us. A program that came about because of a growing recognition that addressing key social determinants of health domains like food insecurity, housing stability, access to transportation, and preventing interpersonal violence and toxic stress can improve the health of communities and reduce overall healthcare costs. As a result, North Carolina Department of Health and Human Services has identified these key Healthy Opportunities initiatives into which NCCARE360 falls. NCCARE360 is a tool that was created to help address social determinants of health by improving the process of connecting people to the community resources they need to be healthy. We work to unite healthcare and human services providers in a shared technology platform that addresses unmet social needs. NCCARE360 is a coordinated network, meaning providers in the healthcare systems like doctors, clinics, hospitals, and insurers, and providers from community-based organizations like food pantries, diaper banks, churches, and shelters are onboarded and connected in this shared web-based platform where they can communicate with each other in real time, assess for and identify unmet social needs, make electronic referrals, securely share client information, and track outcomes together. This functionality allows all of these providers, both in the healthcare system and in the community, to work together to coordinate care for their shared clients and then track those outcomes together so they can see if the person was connected to the resource that they were just referred to. This helps to ensure that everyone is on the same page and that the person seeking assistance is less likely to fall through the cracks and helps to close the care loop. Here is an example of what this might look like in your community. Jane is a community health worker. She visits John, a client in her neighborhood who is interested in enrolling in a vaccine program. During her visit, she finds out that John has been unable to afford groceries. Jane can log in to the NCCARE360 network, find a nearby food pantry, and make a referral to them on behalf of John. The food pantry will receive the referral and determine that they can assist John with his food need. So the food pantry coordinator will contact John to work with him and get him set up to receive food. The next time Jane follows up with John, she'll be able to see in the NCCARE360 platform that the food pantry followed up and provided John with several food boxes. Now Jane can help John focus on any other health issues that may have popped up. NCCARE360 is the result of a strong public-private partnership between North Carolina Department of Health and Human Services and the Foundation for Health Leadership and Innovation, and is carried out by our implementation partners, United Way of North Carolina, NC211, Expound Decision Systems, and Unite Us. This public-private partnership allows community organizations to join and use NCCARE360 for free. FHLI serves as the administrators of the program, primarily responsible for the management and oversight of the platform. We also hold contracts with all implementation partners who are responsible for program implementation and activities. NCDHHS is our collaborative partner for the long-term strategy and vision of the program, as well as assisting with funding opportunities to keep the program going. Our implementation partners perform the four main functionalities of the program. United Way of North Carolina provides a team of resource navigators who can support complex multi-need referrals. They are able to provide support to organizations who may not be able to stay with the client throughout the entire referral process, and they support self-referrals from individuals who submit an assistance request form on our website. Navigators are housed in the NC211 call center, but are assigned specifically to support NCCARE360 cases. United Way of North Carolina also provides a robust, public-facing, statewide resource directory supported by a dedicated resource team. These resources are verified and updated regularly and are replicated for the NCCARE360 platform as out-of-network resources. Unite Us provides the web-based technology platform, which is the referral system where providers are sending, receiving, and managing bi-directional electronic referrals and tracking their outcomes. Unite Us also provides onboarding, training, and technical support through their community engagement team. In July of 2021, NCCARE360 and NCServes joined to increase the number of resources available to active duty service members, veterans, and their families. This has allowed NCServes to address family needs by allowing them to refer veterans, partners, children, and other family members with identified needs to the NCCARE360 network to get connected to services and resources available to civilians. Now we will highlight what it means to be a network partner. We acknowledge that NCCARE360 is a tool, and just like any tool, it works best when we have the commitment from all of our organizations to use it to the best of their ability. We want to make sure that it's clear up front what it is that we ask of our users. We have inclusion criteria we consider when adding organizations to our network. We strive to add partners who are dependable and reliable, and that are providing quality services and will not cause harm or discriminate. Therefore, we partner with organizations who adhere to these requirements. They provide a community service and offer those services at large and not just to its own members. There are nonprofits, government agencies, social or professional organizations, community groups, and so on. We ask that they be licensed and accredited if applicable to their organization type, and they do not discriminate based on race, color, national origin, age, disability, religious beliefs, gender, or sexual orientation. We have a downloadable list of these criteria on our website for those who would like to see the complete list, but these are the key criteria we look for. We ask all of our network partner organizations to agree to our network standards to help increase shared accountability. Our standards are to respond to referrals within 2 business days. This doesn't mean providing a service or resource within 2 business days, but rather that an action has been taken on the referral. For example, it has been accepted, rejected, or held for review. Make 3 attempts over 10 business days to contact unresponsive clients before closing a referral or a case. This ensures we're doing our due diligence in contacting those who are in need. Regularly review and update organization and program information. These include program eligibility requirements, hours of operation, phone numbers, and other information that would be critical for others to know when making a successful referral. Regularly update user information when users leave or should no longer have access, such as when a staff person leaves and a new staff member needs to be assigned to the role. And close cases within 2 business days of case outcome. If you have provided a service, go ahead and close the case as resolved within 2 business days so that the loop can be closed and those working with the client can see that the client has received the resources they needed. When an organization decides to join the NCCARE360 network, they will follow this general process. First, they identify an organization administrator who will manage the onboarding process and serve as the NCCARE360 lead at the organization. This person will complete the inquiry form on our website, which will be routed to our onboarding team at Unite Us. Then, the org admin will receive an official onboarding form which begins the onboarding process once it has been submitted. A virtual onboarding workshop is available to help users navigate this step. Next, the org admin will receive platform login credentials to activate the account. The org admin must log in and enter the organization's information, including the service or resource the program is providing, a list of users, and so on, and this is submitted to the onboarding team. While the organization profile is being completed, all users should attend software training to learn how to use the NCCARE360 Unite Us platform. There are several options available for this, including self-paced and live trainings, so users can learn in the style that suits them best. And there are additional learning opportunities available at the Unite Us website shown at the bottom of the screen. Finally, the organization will launch and use NCCARE360 to send, receive, manage, and track referrals. Anyone who is interested in joining the network is encouraged to visit nccare360.org/join to submit the brief inquiry form to the Unite Us onboarding team. If you have questions, please reach out to us at connect@nccare360.org, which is a shared email inbox that we monitor daily. And anyone who is interested in learning more about NCCARE360 or would like to invite us to speak at or participate in your next event can submit a speaker request at nccare360.org/request-speaker. Thank you for watching this brief presentation on NCCARE360. We hope to hear from you soon.